Good day, everyone. I'm Dr. Lynn Gomez, the head of the Section of Nephrology here at Asian Hospital and Medical Center. I am here today to answer your questions on how to take care of your kidneys. Our first question is, what happens if you have kidney damage? So to be able to answer that, we have to know the functions of the kidney. And the first function of the kidney is excretory. It excretes the waste product of metabolism, and mainly these are your proteins that you eat. The next is balance. So balance entails fluid and electrolyte balance, and that's also requiring balance in homeostasis of your blood volume, which also pertains to your blood pressure. So the third is the hormonal function, which is not very familiar with a lot of people. And this is erythropoietin production, which happens in the kidneys. And erythropoietin is responsible for maturation of your red blood cells. So if you don't produce erythropoietin because of kidney damage, you will have low hemoglobin, and that leads to anemia. The second hormonal function pertains to phosphorus and calcium balance. So phosphorus is no longer excreted when you have kidney failure, and because of that, calcium will now decrease. That is a important relationship, and because of that, parathyroid hormone will be produced in excess, leading to leaching out of calcium from the bone, and then deposition of this excess calcium in organs and also in the blood vessels. And this is dangerous because later on you will have vascular calcification. That means that your blood vessels are very hard and no longer compliant, and this will lead to the bad outcome. The last hormonal function is the production of your renin. Your renin-angiotensin-aldosterone system, we know, is central to the control of blood pressure and restoration of blood volume. So you see, the functions of the kidneys are actually very important: excretory, balance, and hormonal function. So if you have kidney damage, all of these will be affected. That's why you will have retention of waste products such as creatinine, because that is the product of protein metabolism. You will lose balance. You can have failure of excretion of water and electrolytes. And also blood pressure will be very difficult to control. And then you lose all the hormonal function that leads to anemia, vascular calcification, and also very difficult to control blood pressure. So how will you know if you have kidney problems? Actually, there are really very simple tests that you can do. The first one is urinalysis. So they're saying that the urine is the window to the kidney, because in the urinalysis you will see whether you have sugar excretion, protein excretion. Also, you will see whether you have infection or risk for developing urinary tract infection, as well as risk for developing kidney stone. But in terms of the function of the kidney, what we compute now is what we call the estimated glomerular filtration rate. So because if you recall, I said that the function of the kidney is to excrete waste, and this is through filtration. So your kidneys serve as filters, and that it will excrete the unnecessary products of metabolism, and primarily this is urea, creatinine, sulfates, phosphates. And so if you have failure of filtration, you will therefore have failure of excretion of waste. So the substance that we can measure is your serum creatinine. So when we take your blood and measure your serum creatinine, we can now compute for your eGFR. So we have formulas to do that. So when you have kidney problem, you measure your GFR by taking your serum creatinine, you look at your urinalysis, and also you can do certain imaging things like ultrasound or maybe KUB-IDP, but now the screening test is ultrasound. So with the ultrasound, you can see whether you have structural damage to the kidney or whether you can validate chronic kidney disease because of the decrease in size of your kidneys in the imaging. So it's urinalysis, and then it's GFR determination and imaging techniques. Those three will really categorize whether you have kidney problem or kidney damage. So we have to know that worldwide, the #1 cause of chronic kidney disease is diabetes mellitus. This includes the Philippines as well. And the #2 is hypertensive nephrosclerosis. So the 3rd, 4th, and 5th will be the uncommon but important kidney disease as well. So if you have risk factor for diabetes and hypertension, then the possibility of going to chronic kidney disease is really high. You just monitor your sugar and your blood pressure, and if it is abnormal, then you have a risk factor for chronic kidney disease. So the next question that you might like to ask me is, what is the best way to keep your kidneys healthy? So #1, keep fit and be active. So hindi pwede yung couch potato na ginagawa. You have to really do something, exercise. It's not that you need to really make your muscles big. You just maybe walk 20 minutes every day, 5 times a week. I think that will be sufficient. And then #2 is eat a healthy diet. So I told you that the kidneys is for balance. So if you eat a lot of things in excess and you're diabetic and hypertensive, you know that the kidneys will not be able to excrete all these excesses that you eat. So of course, we have the pinggang Pinoy that we are espousing, and this constitutes a plate that has one half will be fruits and vegetables, 1/4 will be carbohydrates, and 1/4 will be protein. So that is how you need to keep and continue eating a healthy diet. So if you are at risk already, you have diabetes and you have hypertension, salt, that's sodium chloride, no? And high sugar is also a no-no in excess. And then the 3rd and 4th is, as I said already, check your blood sugar and check your blood pressure, as these are the #1 and #2 causes of chronic kidney disease. So appropriate fluid intake is the next one. So it is not required that everybody will drink a lot of water. In fact, that is a wrong notion. No? They are saying, oh, you have kidney disease, drink a lot of water. This is only true for people who have kidney stones because they need high fluid intake so that the crystals will not aggregate or solidify. But if you are not a kidney stone former, you just take 8 to 12 glasses a day. And also if you have heart failure, you really don't need to take a lot of fluid. So high fluid intake but not for all. No? And then the next is stop smoking. And I think this is one of the things that's very important. And if not followed, then all the things that you're doing will no longer matter. You really need to stop smoking. So the last two in living well with kidney disease that you certainly should not be forgotten is taking unnecessary drugs. For example, there are certain parts of Asia wherein herbal nephropathy is very common, especially Thailand. This is because of their intake of a lot of unnecessary supplements. So in our country, what is important is to tell our patients, our population, not to take pain medications left and right, no? Because you can see that these medications are detrimental, especially if you have chronic kidney disease. Why is this so? Because these medicines will interfere with the function which is necessary as far as diseased kidneys are. No? It leads to vasoconstriction or constriction of the arteries that are supplying the kidneys. So the other last one is also check your kidneys. If you know already you are at risk, then certainly it's important to monitor. No? And the monitoring depends on the CKD stage. If you are already CKD stage 3, at least every 3 months will be the least amount of time that you should monitor your kidney function. And probably that is the time to see your nephrologist if you are already CKD stage 3. So the fourth question that I'd like to address is who is likely to develop chronic kidney disease? So as I said, the number 1 and the number 2 cause is diabetes and hypertensive nephrosclerosis. So if you have these two conditions already, or if you have a family history, like for example, your parents are diabetics, the possibility that you can become diabetic as well as you approach adulthood and even into older age is very high. And it's not far that you will develop also hypertension in addition to diabetes. But hypertension can also be detrimental by itself. So if you are at risk for these two major conditions, then your kidneys can be affected, because this is how vascular disease happens. No? Remember, the kidneys are balls of capillaries. They are blood vessels, which is designed for filtration. So if you increase the pressure in the kidneys and also damage the small capillaries because of high sugar, then you will certainly develop kidney disease. So the others that are also important will be your primary glomerular disease, and that is diagnosed also based on albumin in the urine, or if it's very severe, you can have manas or edema. And again, the other lesser will be your kidney stone disease, and other uncommon ones will be, of course, not very high in the list, but still equally important. So the last question is, how can we now prevent kidney failure? So I mentioned to you that GFR is the way to stage kidney disease, and that is why when you are already at risk, you monitor your serum creatinine and calculate your estimated GFR. So if you are already approaching GFR of 30 to 60, that's stage 3 already, the possibility of that worsening to stage 4 and stage 5 is really very high as compared to if you are diagnosed early on. Like if you're only stage 2, you can still do a lot and prevent the deterioration of kidney failure. However, please do not stop if you develop kidney failure. I always tell my patient, it is not a death sentence. No? Kidney failure, you can certainly, number 1, delay its progression if you are good in doing the 8 things that I mentioned. And number 2 is you monitor also. No? And then, if you develop kidney failure, you can go to dialysis, and the last is you can undergo kidney transplantation. But our aim is really to prevent the deterioration of kidney disease. So you do the 8 things that I mentioned. Even if you have chronic kidney disease already, you can live well with this chronic kidney disease. No? And if you are on dialysis already, you can still live well for as long as you follow your dialysis sessions. Also, you follow your nephrologist, and you likewise also go to other specialists like cardiologists if your heart is also involved. So with that, I thank you for joining me today in celebrating World Kidney Day, and I hope that this snippet, this information will help you a lot. And we know very well that once information is out there, it is important that we take advantage of this to our benefit. So, happy World Kidney Day to all of you. Salamat po.